All right, let's run through another case study. So this time we've got a patient with some patellofemoral stuff, IT band syndrome, high school volleyball player, going into her senior year, already committed to play Division I volleyball. So good athlete, having relatively acute pain over the last couple of weeks, really hasn't changed her activity level, really hasn't changed her training. Sounds like she does a good job with warm-up, cool-down. So I've seen her previously, probably about a year or two ago, for something unrelated to this. And so she's coming in worried that she's got this problem going into her volleyball season because camp starts this week. I saw her for her initial evaluation last week. So comes in, says that she's been going to physical therapy somewhere else for like 2-3 weeks, not really seeing any improvement, and worried that this is going to become a long-term problem. So asked her what they were doing at previous physical therapy, and she said, well, he's trying to figure out which muscles aren't working and then get them to work. And I said, okay, so how's he figuring out what muscles aren't working? And she said, well, he has me do a squat and then says, okay, well, you're doing this when you're squatting, which means this muscle is not working. And we all know that's not how you assess individual muscle function. And that's not how you, especially with a good athlete, that is not how you assess what's going on here, because she's going to compensate faster than we can see what's going on. So told her, okay, well, that's not how that works. And the reason why you're not getting better is because he doesn't know how to assess what's going on. And I said, well, what is he doing for treatment after that?